You take your pills every single night. Same time, same water, same routine. But here's what almost nobody tells you: for some of the most common medications and supplements, taking them the wrong way can cut how much your body actually absorbs by more than half. One small change, and your pills could work dramatically better. Stick around, because number 4 is the mistake almost everyone makes. Every night, millions of people take medications or supplements right before bed. Vitamin D, fish oil, cholesterol medication, even certain sleep aids. Most of us assume a pill is a pill. Swallow it, and it works.
But not all pills are absorbed the same way. Some depend heavily on one surprising factor: whether there's fat in your stomach when you take them. Some nutrients and drugs are called fat-soluble. That means they don't dissolve well in water. They need dietary fat to be broken down and carried into your bloodstream. Take vitamin D, one of the most commonly taken evening supplements. Studies show absorption can be up to 50% higher when it's taken with a meal containing fat compared to on an empty stomach. The same goes for vitamin K, vitamin A, and vitamin E. All 4 fat-soluble vitamins follow this exact rule. Without fat present, a large portion of the dose can simply pass through the body and unused. This isn't just about vitamins. Several prescription medications behave the same way, including certain cholesterol drugs, some antifungal medications, and specific seizure medications. Here's why timing at night matters even more. Many people take evening pills right before bed, on an empty stomach, hours after dinner has already been digested. An empty stomach means there's little to no fat available, so the pill enters an environment that isn't set up to absorb it properly, and much of it may be wasted. Over weeks and months, this adds up. Someone could be taking their medication exactly as prescribed every single day and still not get the full benefit, simply because of what's happening around it in the stomach. The fix is remarkably simple. Pair your evening pill with a small fatty snack. Just a spoonful of peanut butter, a few nuts, a slice of cheese, or a piece of avocado can make a measurable difference. Research suggests it doesn't take much. Even a modest amount of fat, around 10 to 15 grams, is often enough to significantly improve absorption. For example, one commonly prescribed cholesterol-lowering medication has been shown in studies to absorb significantly better when taken with food containing fat rather than on an empty stomach. Fish oil supplements are another major example. Taken alone on an empty stomach, much of the omega-3 content may go unabsorbed. Taken with a meal, absorption improves dramatically. Not every pill needs this. Water-soluble vitamins like vitamin C or B complex dissolve just fine without fat, and taking them with food doesn't make much difference. So how do you know if your medication falls into this category? The safest step is to check the label or ask your pharmacist directly whether it should be taken with food. It's also worth taking your pills the same way every day. Absorption can vary if you sometimes take a pill with food and sometimes without. Consistency helps keep the effect predictable. One important note: not all interactions with food are helpful. Some medications actually absorb worse with fat or interact poorly with specific foods, which is exactly why checking with a pharmacist matters more than guessing. This is one of those rare health habits that costs nothing, takes seconds, and is backed by real pharmacological research. Yet almost nobody talks about it. To recap, fat-soluble vitamins and certain medications absorb far better with dietary fat. Evening pills are especially at risk since they're often taken on an empty stomach. The fix? A small, fatty snack alongside your dose. Before your next dose, check whether your medication or supplement is fat-soluble. It could be the simplest upgrade to your routine all year. If this helped, subscribe for more evidence-based health breakdowns like this one.